The Delta variant is fueling a new surge of COVID-19 cases in the U.S., with cases more than doubling in the past 3 weeks. Here in our state, new data from Yale finds that the Delta variant is the dominant strain in Connecticut. Joining the discussion tonight is Dr. Ulysses Wu, an infectious disease specialist with Hartford Healthcare. Thank you so much, Dr. Wu, for joining us. And to get right into it, we did see an increase in the positivity rate for Connecticut to above 1% today. What does that mean for COVID cases in our state, and can we attribute that to the Delta variant?
Yes, I do think we can attribute it to the Delta variant. What this means with regards to what is going to happen in the near future, it's unknown. Connecticut has done such a magnificent job in terms of its vaccination and its vaccination rates, and I think it's holding the Delta variant at bay because it does work. But we have to it does work against the Delta variant. We have to remember the primary goal of the vaccination is not necessarily to prevent disease, but to take a potentially deadly disease and turn it into a normal disease, i.e. like the common cold. And we saw that in other countries where cases were skyrocketing, but hospitalizations and deaths were actually remaining pretty flat. And we're kind of seeing the same trend here in Connecticut as well. We still have our share of hospitalizations, and unfortunately there have been some deaths, but it has remained fairly flat over the past month.
You know, it brings me to my next question. Are we seeing breakthrough cases involving the Delta variant, and just how effective are those vaccines against the Delta variant here?
Yeah, so I will be honest with you. For the hospitalized and the unfortunate deaths that are happening, we can say for certainty that 95 to 99% of those are in unvaccinated people. Now, like I said before, you still may get infected, but the vaccine's doing its job in terms of turning a potentially deadly disease into a normal disease, i.e. the common cold. And so, yes, we can attribute it to the Delta variant, but we think the vaccine is doing its job for keeping people out of the hospital and trying to keep them from dying.
And last question for you, what symptoms should we be looking out for specifically with this Delta variant?
Well, it's still the same symptoms that we should be looking for. And unfortunately, with the unmasking of our society, we're starting to see some of the other viruses that we normally would have seen during the winter. We're seeing more common colds, such as the rhinovirus. We're seeing something called RSV, which is typically seen in the winter. We've even seen a smattering of influenza cases. So the symptoms may unfortunately all mimic each other. But the one that I like to point out the difference is the common cold. Typically, you don't have high fever. Typically, you don't have a bad cough or shortness of breath. If you have those, you should consider that you have coronavirus, as well as symptoms of loss of taste and smell.
All right, Dr. Wu, thank you so much for your time. We appreciate it.
Thank you for having me.
We still